Video titled Femto Capsulotomy Blues will discuss not just the benefits but also the challenges that come with capsulotomy in femtosecond laser-assisted surgery. The authors have no financial interest in the content of this video. So capsulotomy in femtosecond laser-assisted surgery has a significant advantage in terms of being well-centered and circular. But it comes with its own set of challenges, particularly for someone starting out. One of these involves the challenges when you have a small pupil, such as in this case. What usually does work very well and something that we and many other surgeons do is to cheat the machine a little bit, where you manually increase the measured pupil size and then choose the pupil maximized option for your capsulotomy. This gives you a well-centered, reasonably sized capsular opening. However, in some cases, such as in this one, you have the challenge of uncut areas of the anterior capsule. You can see that in this case, there is area of overlap of the pupil over the anterior capsule. There is some pigment dispersion that is noticed, and therefore it is apparent that in this case, there is an uncut area of the anterior capsule, which is why it's important to be extremely careful and extremely gentle and remove this like a manual capsular excess. Our other area is white mature cataracts. One of the biggest advantages of flax capsulotomy is in white mature cataracts, but you can also occasionally have challenges here. You can see that the capsulotomy is being performed adequately. It is a well-centered capsular opening, and it's important to stain the anterior capsule even in cases of flax. And here it looks like a well-centered, completely cut capsulotomy, but you can see that there are uncut areas here. These can also be referred to as skip areas. And therefore, when you're removing the anterior capsule, even in flax, it's extremely important to make sure that you're removing it like a manual capsular excess. In this case, it looked like a complete capsulotomy, but you can see that there was an extension posteriorly, and that was followed by a drop of nuclear contents. Another case scenario where you can occasionally have challenges is patients that have undergone a radial keratotomy in the past. Now here again, flax can be safely done, and in most cases you get a well-centered circular capsulotomy, but here again you can have uncut areas. That's why extremely important not to pull on the anterior capsule, assuming that it is a completely cut capsulotomy, and important to be extremely gentle to ensure that the capsule doesn't extend peripherally. So the first few steps require careful attention. The capsule should be removed as if you were doing a manual capsular excess. In this video again, you can see that the capsule is being removed as if a manual capsular excess is being done. The hydrodissection is extremely important as well. Be more gentle in these cases. Do a gradual rock and roll maneuver, because you can have these trapped air bubbles behind the nucleus and in front of the posterior capsule, which can cause a pressure buildup, and especially in hard cataracts, the posterior capsule can give way because of that pressure. It's important to ensure a good nuclear rotation in these cases as well. Thank you.